one of the areas that I wanted to go to is the medical marijuana, and I was glad to work with the legislation on the task force when we were trying to bring up this compromise and get something through. So I have a couple questions, just having been through hours and hours and many, over a year of working with trying to get something that we could vote on. One of the issues that came up while we were talking to everybody is a lot of the dollars and where they went. And one of the areas, three of the areas that we stipulated was research. Obviously, that was desperately needed, and the ability for us to take a look at. And I know we're hampered by the federal government with that. So we had 30% supposed to go to research programs. We had 10% going to DDAPT for more counseling and education, and then we had a 5% that was supposed to go to local police to help with the drug issue. But I don't see those transfers happening. Can you explain what's holding that up?
Sure. So in 1819, the medical marijuana office projects to generate approximately $8 million. In 1920, to generate approximately $20 million. Those funds will be distributed in 2021. So the program has to become mature enough to be able to support itself, repay the loan to the general fund, the $3 million loan, and then those funds will be distributed. So we're anticipating that will be in fiscal year 2021.
Okay, so this right now, if I look at from the budget documents, you have $6 million in there now. Why are we not paying back the loan now?
We anticipate to pay back the loan at the end of this budget year, 1920.
The end of 1920, with the dollars that are in right now.
With the money that will be coming in by the end of 1819,
okay,
and then 1920, we expect to repay it at the end of the budget that we're talking about now.
Okay.
1920.
Okay.
In about a year and a couple months.
So the $6 million that's there now is used
funding the program.
The operation of it as it is? Okay.
That's correct.
So the ability for us
to repay that loan, as you said.
Okay. So the ability for us to pay that back and then dispense those dollars to those other entities with the clinical and that type of thing. Correct?
Yes, that would be
okay.
in 2021.
Okay.
Now the Chapter 20 program, that hasn't started yet. So that's the research program. The
right.
8 academic research centers
right.
have been chosen. The first round of clinical registrants, which will provide the grower processors and dispensaries for that program, were not sufficient. So we have a second round starting for clinical registrants, and we anticipate that will be successful. And then we will have a convening. I will call all of them together to the Department of Health to talk about research. My background is in academic medicine, so I understand medical research very well. And so we want to have a robust medical research program that will really, I think, be the best in the nation in terms of clinical research for medical marijuana.
Okay, and along those lines, I had a few other questions actually dealing kind of with backgrounds of research. So my understanding is that you had approved what the board had mentioned about the dry leaf.
That's correct.
Okay, what is it that dry leaf gave you that what was already approved did not?
Okay, so there are a couple of reasons why I approved dry leaf. One is that almost all of the research, 99% of the research in the United States on medical marijuana has been generated using product from the University of Mississippi, and it was all dry leaf. And so all the research generated in the United States has been with dry leaf. There are other countries that have used other substances, but the United States has been very tightly regulated by the DEA. So it did not seem to make sense to prohibit the product that actually has generated all of the United States research.
Well, and my understanding with dry leaf, and I'm not an aficionado, so tell me what I don't know. The dry leaf, my understanding is we made it not eligible, nothing can be smoked. My understanding was dry leaf, that's what it was for, no?
So dry leaf can be used.
How else can it be used, I guess?
Vaporization device.
It can do vapor then?
Right. And
as
so
well.
all the dry leaf that is approved by the medical marijuana office,
right.
dispensaries, grower processors, dispensaries, is to be used in a vaporization device. It legally is not allowed to be smoked.
Okay. And so the other one, you went from 17 to 21.
That's correct.
And it said opioid use disorder.
That's correct.
Okay. So we're treating a drug disorder with a drug itself, with another medical marijuana.
So there was a couple of reasons why I specifically approved that. One is that there is evidence Not as robust evidence as we would like, but in my research, there is evidence of people using medical marijuana, particularly heavy in CBD, cannabidiol, because there are different types of compounds in medical marijuana for patients with opioid use disorder and addiction. And I've spoken with a number of different specialists that, that are now using it for that purpose. Let me just finish, though. The second reason why I specifically allowed opioid use disorder is because to have that research that we spoke about, it has to be an approved condition. So you cannot do research on conditions that aren't approved. And so if we want more research of using CBD-rich medical marijuana, et cetera, for opioid use disorder, then I had to approve the condition. And so we wanted to provide physicians with another tool in the toolbox in light of the opioid crisis.